NCLEX-RN Practice Questions. Question 51. On post-delivery day 1, a client who experienced preeclampsia during her pregnancy is receiving 4 magnesium sulfate. The nurse caring for the client wants to be sure that the antidote for magnesium sulfate toxicity is readily available. The nurse should look for which medication? A. Calcium gluconate. B. Narcan. C. Nubain. D. prostaglandin.
Correct answer, A. Calcium. Rationale: calcium gluconate is the antidote for magnesium sulfate toxicity.
NCLEX-RN Practice Questions. Question 52. A nurse receives a telephone order for intravenous fluids for a client. What should the nurse do first? A. Hang the ordered fluids. B. Refuse to hang the fluids until given a written order. C. Document the phone call and telephone order. D. Read back the order to the ordering physician.
Correct answer, D. Read back the order to the ordering physician. Rationale: the nurse should first read back the order to the prescribing physician to confirm that it was transcribed correctly.
NCLEX-RN Practice Questions. Question 53. A nurse is admitting a client who has a cellulitis infection. The client states that he has a healthcare proxy. Which is the best response by the nurse? A. You don't need a healthcare proxy. You only have a minor infection. B. I'll let you know if it becomes necessary to have it in your chart. C. I'll make a copy of it, place it in your chart and let your doctor know. D. You'll just need to let your doctor know about your wishes. Correct answer, C. I'll make a copy of it, place it in your chart and let your doctor know. Rationale: the nurse should take a copy of the directives, place them in the chart, and inform the provider. The nurse should also make sure that they are documented appropriately within the hospital according to policy. NCLEX-RN Practice Questions. Question 54. A nurse is assessing a neonate's head and notices that there is edema of the soft tissues. The edema crosses over the suture lines. The nurse should document this as A. Caput succedaneum. B. Cephalhematoma. C. Crowning. D. Molding. Correct answer, A. Caput succedaneum. Rationale: caput succedaneum is swelling of the soft tissues that cross the suture lines. It will typically resolve a few days after birth. NCLEX-RN Practice Questions. Question 55. A nurse is caring for a client with terminal cancer. The client's spouse appears exhausted and expresses the need for a break. Which referral is most appropriate for this client? A. Crisis intervention. B. Respite care. C. Community support group for caregivers. D. Clergy. Correct answer, B. Respite care. Rationale: respite care helps burdened caregivers get a break when they get overwhelmed. This is the best referral for this client.
NCLEX-RN Practice Questions. Question 56. A nurse is teaching a class on fetal development. She explains that after fertilization, the blastocyte travels down the fallopian tubes and then implants into the uterus. The nurse should explain that implantation usually occurs how many days after fertilization? A.1 to 4. B.3 to 7. C.7 to 10. D.10 to 14. Correct answer, C. 7 to 10. Rationale: implantation usually occurs 7 to 10 days after fertilization. NCLEX-RN Practice Questions. Question 57. A client is being treated in a medical surgical unit for cellulitis of the left lower extremity. The nurse caring for the client reviews the physician's orders expecting which of the following therapies to have been ordered? A. Alternating hot and cold compresses. B. Cold compresses to the lower leg. C. Intermittent heat lamp treatments. D. Warm compresses to the lower leg. Correct answer, D. Warm compresses to the lower leg. Rationale: moist heat is most useful in treating this disorder. Warm compresses may be used to decrease the discomfort, erythema, and edema that are associated with cellulitis. Other treatment modalities include appropriate antibiotic therapy after cultures have been done. Managing symptoms such as fatigue, fever, chills, headache, or myalgia should also be considered. NCLEX-RN Practice Questions. Question 58. 2 days following a myocardial infarction, the client states, it was just a little chest pain. As soon as I get out of here, I'm going on vacation. Which nursing intervention is appropriate to include in the client's care plan? A. Allow the use of denial as a coping mechanism until the client starts asking questions about the me. B. Begin teaching the client about the normal functions of the heart to improve his understanding of the me. C. If family members or a significant other encourage the client to continue planning for the vacation. D. Redirect the client. Implement reality orientation by reminding the client several times a day about the me. Correct answer, A. Allow the use of denial as a coping mechanism until the client starts asking questions about the me. Rationale. Denial is a normal coping mechanism after an acute event such as in me. Waiting until the client asks questions about the me will improve the client's ability to absorb needed information. NCLEX-RN Practice Questions. Question 59. A client has developed digitalis toxicity. The client is stable. Which of the following actions would be considered most appropriate in this situation? A. Administering activated charcoal. B. Administering atropine. C. Preparing the client for hemodialysis. D. Symptomatic treatment and time. Correct answer, D. Symptomatic treatment and time. Rationale. Stable clients with digitalis toxicity are best treated with time while their kidneys excrete the metabolites. Symptomatic treatment for rhythm disturbances or nausea is also indicated. NCLEX-RN Practice Questions. Question 60. A nurse is caring for a client with terminal cancer. The client's spouse appears exhausted and expresses the need for a break. Which referral is most appropriate for this client? A. Crisis intervention. B. Respite care. C. Community support group for caregivers. D. Clergy. Correct answer, B. Respite care. Rationale. Respite care helps burdened caregivers get a break when they get overwhelmed. This is the best referral for this client. A clergy member can be helpful at identifying other community resources and providing support but does not address the main issue of the client needing a break. NCLEX-RN Practice Questions. Question 61. A client with cirrhosis is receiving Cephulac, lactulose. During the client's routine assessment, the nurse notes increased confusion and asterixis. The nurse should complete which of the following based on these findings? A. Assess for gastrointestinal, GI, bleeding. B. Evaluate the client's serum bilirubin levels. C. Hold the client's next dose of lactulose. D. Increase the client's dietary intake of protein. Correct answer, A. Assess for gastrointestinal, GI, bleeding. Rationale. Clients with cirrhosis may develop hepatic encephalopathy. This is caused by increased ammonia levels. Flapping tremor is a characteristic symptom of increased ammonia levels. GI bleeding and protein consumed in the diet increase protein in the intestine and can elevate ammonia levels. Thus, the client in this situation should be assessed for GI bleeding. NCLEX-RN Practice Questions. Question 62. After delivery, a nurse is administering vitamin K to a neonate. The order is to give 1 mg of aquamaphytin. On hand is aquamaphytin 2 mg per milliliter. How many mls should the nurse administer to the neonate? A. 0.25 milliliters. B. Half a milliliter. C. 1 milliliter. D. 2 milliliters. Correct answer, B. Half a milliliter. Rationale. Half a milliliter contains 1 milligram of aquamaphytin. NCLEX-RN Practice Questions. Question 63. A client in a medical surgical unit develops diabetic ketoacidosis. An insulin drip is initiated with 50 units of insulin in 100 milliliters of normal saline solution. The fourth is being infused via an infusion pump. The pump is currently set at 10 milliliters/hour. The nurse determines that the client is receiving how many units of insulin each hour? A. 5 units per hour. B. 3 units per hour. C. 8.3 units per hour. D. 20 units per hour. Correct answer, A. 5 units per hour. Rationale. To determine the number of insulin units the client is receiving per hour, the nurse must first determine the number of units in each ml of fluid. 50 units per 100 milliliters equal to 0.5 units per milliliter. Next, the nurse multiplies the units per milliliter by the rate of ml per hour. 0.5 units per milliliter times 10 milliliters per hour equal 5 units per hour. So, this patient is receiving 5 units of insulin each hour. NCLEX-RN Practice Questions. Question 64. A client being treated in a medical surgical unit is receiving tube feedings. Over the past 2 days, the client has developed diarrhea, cramps, and abdominal distention. Which of the following interventions would be most appropriate for the nurse to complete? Select all that apply. A. Anticipate changing to a lactose-free formula. B. Change the feeding apparatus every 24 hours. C. Slow the administration rate. D. Use a diluted formula, gradually increasing the volume and concentration. E. Use a higher volume of formula because the formula may be too hypotonic. Correct answer, A, B, C, D. A. Anticipate changing to a lactose-free formula. B. Change the feeding apparatus every 24 hours. C. Slow the administration rate. D. Use a diluted formula, gradually increasing the volume and concentration. Rationale: lactose intolerance can cause diarrhea. Diarrhea can occur as a result of bacterial contamination if fresh formula is not used or stored in a refrigerator, or if the feeding apparatus is not changed at least every 24 hours. Rapid formula administration may cause diarrhea. Low serum albumin level may cause diarrhea. NCLEX-RN practice questions. Question 65. A client is made aware that vascular access is required for hemodialysis. The client asks the nurse what are the differences between an arteriovenous, AV, fistula and a graft. The nurse correctly explains that one advantage of the fistula is which of the following? A. It can accommodate a variety of needle sizes. B. Clotting is less likely to occur. C. It may be accessed much sooner after surgery. D. It provides for increased client mobility. Correct answer, B. Clotting is less likely to occur. Rationale: AV fistulas are much less likely to clot than grafts because they do not require the use of synthetic materials. NCLEX-RN practice questions. Question 66. A client is seen in the emergency department for a sprained wrist. During the triage assessment, the client also reports finding a pea-sized lump while performing a testicular self-examination, TSE. The most appropriate response by the nurse is which of the following? A. You will need to check again next month. If the lump is still present, contact your healthcare provider. B. It is normal to have small lumps as you have described, don't worry, I'm sure everything will be fine. C. This sounds serious, it could possibly be cancer. I'll be sure to tell the physician to take a look. D. This is important information for you to tell the physician today. I will also tell the physician. Correct answer, D. This is important information for you to tell the physician today. I will also tell the physician. Rationale: any lump or swelling noted during a TSE should be reported to a physician as soon as possible. NCLEX-RN practice questions. Question 67. A nurse is caring for a young adult client who has a fractured pelvis after getting hit by a car while walking home from work. The client lives alone and does not have family nearby. Which discharge options should the nurse explore for this client? A. Discharge to home when ready. B. Discharge to a short-term rehabilitation facility. C. Discharge to home with a home health aide twice a week. D. Discharge to home with physical therapy 3 times a week. Correct answer, B. Discharge to a short-term rehabilitation facility. Rationale: a broken pelvis will require a significant amount of physical therapy and time to heal. Sending the client home won't give him the help or time needed to recover. NCLEX-RN practice questions. Question 68. A nurse manager is scheduling nursing shifts for the next week. Which client would be best placed with a new nurse? A. A client who sustained a leg fracture during a sporting event. B. A client with multiple medical problems and polypharmacy. C. A client with septicemia after a urinary tract infection. D. An alcoholic client who is actively detoxing from alcohol. Correct answer, A. A client who sustained a leg fracture during a sporting event. Rationale:
mildly annoyed to comically annoyed. A. Personal space, damn it. I'll sue, he yelled while being pulled around by the creature, adding, don't just go cooking things without telling me first then. Once he'd finally reached the table, his heels dragging the whole way. Upon reaching table Kuan, he gave the gouges a sympathetic look, internally apologizing to the table for letting this freak hurt it. He shook off Buddy's grip with an annoyed huff, smoothed out his clothing, and spat, next time, actually consider that someone has things to do other than eat, before setting himself down at the table. He cupped his chin in thought, eyes dancing over the food to take it in and check for any immediate abnormalities.
NCLEX-RN Practice Questions. Question 69. A nurse is caring for a client who suffered a myocardial infarction 2 days ago. The client tells the nurse, "I feel dizzy." The client's blood pressure is 90/60ths of a millimeter of mercury, and the cardiac monitor shows the following. The most appropriate intervention for the nurse to implement is which of the following? A. Prepare for non-invasive temporary pacing. B. Instruct the client to complete the Valsalva maneuver. C. Prepare the client for defibrillation. D. Reevaluate the client in 30 minutes and document findings. Correct answer, A. Prepare for non-invasive temporary pacing. Rationale: the client is experiencing symptomatic bradycardia. Symptomatic bradycardia is confirmed by the client's complaints of dizziness with accompanying hypotension. If the cause is unknown, the nurse should prepare for non-invasive temporary pacing. Non-invasive pacing is an emergency measure to provide ventricular pacing to increase the heart rate in symptomatic clients. NCLEX-RN Practice Questions. Question 70. A client developed a deep vein thrombosis following hip surgery. The client is receiving an intravenous infusion of heparin sodium at 1,800 units per hour. The concentration in the bag is 25,000 units per 500 milliliters. How many milliliters of solution will the nurse document as input for the first 4 hours of the shift? A. 18 milliliters. B. 36 milliliters. C. 144 milliliters. D. 288 milliliters. Correct answer, C. 144 milliliters. Rationale: first, calculate how many units are in each milliliter of the medication. 25,000 units per 500 milliliters equals 50 units per milliliter. Next, calculate how many milliliters the client receives each hour. 1 milliliter per 50 units times 1,800 units per hour equals 36 milliliters per hour. Lastly, multiply by 4 hours. 36 milliliters per hour times 4 hours equals 144 milliliters. NCLEX-RN Practice Questions. Question 71. An 18-month-old infant is in for a routine well baby visit. The nurse is taking the child's chest circumference. Where should the nurse place the tape measure? Correct answer, B. Rationale: the tape measure should be placed across the nipple line to get the most accurate chest circumference measurement. NCLEX-RN Practice Questions. Question 72. A client is taking Thorazine for relief of psychotic symptoms. The client begins to experience adverse reactions including gait shuffling, drooling, and dystonia. These adverse reactions are classified as which of the following? A. Akathisia. B. Drug-induced Parkinsonism. C. Dystonia. D. Tardive dyskinesia. Correct answer, D. Tardive dyskinesia. Rationale: tardive dyskinesia extrapyramidal symptoms include gait shuffling, drooling, and dystonia. NCLEX-RN Practice Questions. Question 73. A nurse is performing a psychosocial assessment on a client who is 10 weeks pregnant. The client states that she is not sure how she feels about the pregnancy. Which is the most appropriate intervention by the nurse? A. Allow the client to verbalize her feelings. B. Document the client's feelings of ambivalence. C. Notify the physician. D. Refer the client to an abortion clinic. Correct answer, A. Allow the client to verbalize her feelings. Rationale: the client should be encouraged to verbalize her feelings to facilitate resolution of the feelings of ambivalence. NCLEX-RN Practice Questions. Question 74. A nurse finds an adult client on the floor, unconscious in the bathroom. The nurse completes a rapid nursing assessment, which will include palpation of which of the following pulse sites? A. Brachial. B. Carotid. C. Popliteal. D. Radial. Correct answer, B. Carotid pulse. Rationale: the carotid pulse is initially assessed in an unconscious adult. NCLEX-RN Practice Questions. Question 75. A nurse learns several clients will be arriving at the emergency department after a major trauma. Which client could be safely discharged to make room for the more seriously injured? A. A client with a sprained ankle after twisting the foot while running. B. A client who lost consciousness after a minor motor vehicle collision but who is alert and oriented now. C. A client with a blood sugar of 357 micrograms per deciliter. D. A client with chest pains and a history of anxiety. Correct answer, A. A client with a sprained ankle after twisting the foot while running. Rationale: A client with a sprained ankle is stable and able to care for himself or herself. The client could be safely discharged with pain medication, discharge notes, and instructions to return if the pain worsens. NCLEX-RN Practice Questions. Question 76. An experienced staff nurse observes a newly hired staff nurse caring for a client who has had a craniotomy for a brain tumor less than 24 hours ago. Which action by the inexperienced nurse requires the experienced nurse to intervene immediately? A. The staff nurse has the client deep breathe and cough. B. The staff nurse assesses neurologic status every hour. C. The staff nurse elevates the head of the bed to 30 degrees. D. The staff nurse administers an analgesic before turning the client. Correct answer, A. The staff nurse has the client deep breathe and cough. Rationale: coughing can increase intracranial pressure, ICP, and is generally discouraged for clients at risk for increased ICP, especially clients who recently underwent a craniotomy for a brain tumor. NCLEX-RN Practice Questions. Question 77. A nurse enters the linen room and observes a small but quickly spreading fire in the back of the room. Which should the nurse do first? A. Pull the fire alarm. B. Close the doors and windows. C. Remove the clients from the room. D. Use a fire extinguisher to put out the fire. Correct answer, A. Pull the fire alarm. Rationale: since there are no clients in the linen room needing to be rescued, the nurse should first pull the fire alarm to start the emergency response. NCLEX-RN Practice Questions. Question 78. A client presents to the urgent care center stating episodes of losing my balance. The client also expresses difficulty with grasping small objects and fastening clothing. The nurse recognizes that which area of the brain, marked below with an X, may not be functioning properly? A. Brain stem. B. Cerebellum. C. Frontal lobe. D. Occipital lobe. Correct answer, B. Cerebellum. Rationale: the client is stating disturbances in balance, grasping small objects, and fastening clothing. Balance and gross and fine motor skills are controlled by the cerebellum. NCLEX-RN Practice Questions. Question 79. A client on a telemetry unit is receiving a blood transfusion. During the transfusion, the client experiences an acute hemolytic reaction. The most appropriate nursing interventions are which of the following? A. Immediately stop the transfusion, infuse dextrose 5% in water, D5W, and notify the physician and the blood bank. B. Immediately stop the transfusion, infuse normal saline solution, and notify the physician and the blood bank. C. Slow the transfusion, obtain the client's vital signs every 15 minutes over the next hour, and notify the physician. D. Stop the transfusion immediately, notify the physician and the blood bank, and administer antihistamines. Correct answer, B. Immediately stop the transfusion, infuse normal saline solution, and notify the physician and the blood bank. Rationale: the transfusion should immediately be stopped, normal saline solution should be infused to maintain venous access, and the physician and the blood bank should be notified immediately. Other nursing actions include saving the blood bag and tubing, rechecking the blood type and identification numbers on the blood tags, monitoring vital signs, obtaining necessary laboratory blood and urine samples, providing proper documentation, and monitoring and treating for shock. NCLEX-RN Practice Questions. Question 80. A nurse is assessing the reflexes of a 3-month-old infant. The nurse determines that the infant may need further neurologic screening based on the presence of which of the following reflexes? A. Palmar grasp. B. Rooting. C. Stepping. D. Tonic neck. Correct answer, C. Stepping. Rationale: the stepping reflex disappears at 2 months of life. Its continued presence may be an indication of neurological damage or disease, and further screening may be needed. NCLEX-RN Practice Questions. Question 81. A graduate nurse is completing a critical care course at the local hospital. The following rhythm strip is noted on the course examination. The graduate nurse correctly identifies the tracing as which of the following? A. Atrial fibrillation. B. Multifocal PVCs. C. Ventricular fibrillation. D. Ventricular tachycardia. Correct answer, D. Ventricular tachycardia. Rationale: the rhythm is ventricular tachycardia, VT. VT consists of 3 consecutive QRS complexes originating from the ventricles and recurring at a rate greater than 120 beats per minute. NCLEX-RN Practice Questions. Question 82. A client with dysphagia is receiving daily enteral feedings. The nurse should monitor which of the following to determine the effectiveness of the tube feedings and the client's nutritional status? A. Calorie count. B. Daily weight. C. Hourly intake and output. D. Serum protein and bun levels. Correct answer, B. Daily weight. Rationale. The most accurate assessment of the effectiveness of the tube feedings and the client's nutritional status is the use of daily weights. NCLEX-RN Practice Questions. Question 83. A client's blood lithium level is 0.3 MEq per liter. The nurse realizes that this level is which of the following? A. Less than therapeutic. B. Therapeutic. C. Greater than therapeutic. D. Toxic. Correct answer, A. Less than therapeutic. Rationale. A level of lithium that is 0.3 MEq per liter is lower than the lowest therapeutic level of 0.6 MEq per liter. NCLEX-RN Practice Questions. Question 84. A nurse complains to a colleague about another staff member who is never on time when meeting to give report, causing the nurse to leave the unit late. At which stage of conflict are these two nurses? A. Frustration. B. Conceptualization. C. Taking action. D. Resolution. Correct answer, C. Taking action. Rationale. Taking action occurs when someone who is involved in the conflicts acts in a passive, aggressive, or hostile manner. In this situation, the first nurse is gossiping and complaining about the other nurse. This is an example of taking action. NCLEX-RN Practice Questions. Question 85. A nurse is assessing a college sophomore student. The student states that although she has done very well in all of her classes so far, she is worried about passing an upcoming test. The nurse knows that a mild level of anxiety can cause which of the following? A. Distorted perception of reality. B. Fixation on fear or worry. C. Motivation for positive growth. D. Sense of impending doom. Correct answer, C. Motivation for positive growth. Rationale. Mild levels of anxiety can be a source of motivation for the positive growth of an individual. NCLEX-RN Practice Questions. Question 86. A nurse is observing a student give a client a complete bed bath. Which action by the student should be corrected immediately? A. The student places towels underneath the client before starting the bath. B. The student begins by washing the client's eyes and face. C. The student pulls back the blanket before beginning the bed bath. D. The student raises the bed to a comfortable working height. Correct answer, C. The student pulls back the blanket before beginning the bed bath. Rationale. The student should only uncover the part of the client's body that is currently being washed and leave the rest of the body covered up in order to keep the client warm. NCLEX-RN Practice Questions. Question 87. A nurse is assisting with the transfer of a client to a stretcher to be brought down to the procedure area. The client's current weight is 180 kilograms. Which piece of equipment should the nurse make sure is in the room? A. Mechanical lift. B. Gate belt. C. Slide board. D. Draw sheet. Correct answer, A. Mechanical lift. Rationale. A client who weighs 180 kilograms is around 400 pounds and the nurse will need assistance in making the transfer to the stretcher. A mechanical lift is the safest way to do that without risking injury to the nurse or other staff. NCLEX-RN Practice Questions. Question 88. A nurse is caring for a 5-month-old infant. The nurse plans her care knowing that the infant should have reached which of the following developmental milestones? A. Holding head erect. B. Rolling from back to front. C. Sitting independently. D. Walking alone. Correct answer, A. Holding head erect. Rationale. An infant is expected to hold its head erect by 4 months of age. NCLEX-RN Practice Questions. Question 89. A 20-year-old client is admitted to the medical surgical unit with a diagnosis of Crohn's disease, inflammatory bowel syndrome. Which of the following therapies should the nurse appropriately include in the client's plan of care? A. Antidiarrheal medications and corticosteroid therapy. B. High-fiber foods and high-protein milkshakes. C. Lactulose therapy and potassium supplements. D. Raw fruits and vegetables and high-caloric foods. Correct answer, A. Antidiarrheal medications and corticosteroid therapy. Rationale. Antidiarrheal medications are indicated to combat diarrhea by decreasing peristalsis. Corticosteroid therapy also reduces the signs and symptoms of diarrhea, in addition to pain and bleeding, by decreasing inflammation. NCLEX-RN Practice Questions. Question 90. A client has ongoing abdominal pain and cramping that has led to impairment in the client's social and professional life. Testing, however, has demonstrated that there is no physiological basis for the client's symptoms. The nurse knows that the client is exhibiting symptoms of which of the following disorders? A. Anxiety. B. Personality. C. Schizophrenia. D. Somatoform. Correct answer, D. Somatoform. Rationale. Symptoms of somatoform disorders include physical symptoms without an organic basis. NCLEX-RN Practice Questions. Question 91. A nurse is reviewing lung sounds with the nursing staff during an educational session. Which of the following descriptions best describes crackles? A. They produce a fine, medium, or coarse sound. B. They produce a distinct grating sound. C. They produce a high-pitched, musical squeak. D. They produce a low-pitched noise resembling snoring. Correct answer, A. They produce a fine, medium, or coarse sound. Rationale. Crackles result from air moving through airways that contain fluid. They are audible during both inspiration and expiration. Crackles are discrete sounds that vary in pitch and intensity and can be classified as fine, medium, or coarse. NCLEX-RN Practice Questions. Question 92. A nurse is initiating breath therapy for a client with cervical cancer. Which instructions should be included when teaching the client about the treatment? Select all that apply. A. To avoid letting anyone pregnant enter the room. B. To get up and walk around the room as much as tolerated. C. To keep visiting time to less than 1 hour. D. To stay confined to the room. E. To immediately dispose of an implant that has fallen out into the garbage. Correct answer, A, C, D. A. To avoid letting anyone pregnant enter the room. C. To keep visiting time to less than 1 hour. D. To stay confined to the room. Rationale. Women who are pregnant and young children under the age of 18 should be prevented from entering the client's room while the implant is in place. Visiting hours should be limited to under an hour to reduce the amount of radiation that guests are exposed to. Family members should remain around 6 feet away from the client. Women who are receiving breath therapy must remain in their room at all times, except as medically necessary, such as for medical procedures. NCLEX-RN Practice Questions. Question 93. A client presents to the emergency department following a fall sustained while hiking. X-ray imaging reveals a fractured right leg. Upon discharge, the nurse instructs the client on the proper use of crutches while stair climbing. Client teaching has been effective when the client states which of the following? A. I will place the crutches on the first step and then swing both of my legs upward on the step and do the same moving up the stairs. B. I will place the crutches and my right leg on the first step, followed by the left leg, and continue in the same fashion moving up the stairs. C. I will place my left leg on the first step, followed by the crutches and my right leg, which should move together. D. I will place my right leg with the crutch on my left side on the first step, the left leg and crutch on the right side should follow. Correct answer, C. I will place my left leg on the first step, followed by the crutches and my right leg, which should move together. Rationale. When climbing stairs with crutches, the client should lead with the unaffected leg, left, followed by the crutches and injured leg, right, moving together. NCLEX-RN Practice Questions. Question 94. A female client with multiple sclerosis, MS, is admitted to the medical surgical unit. The client is intermittently experiencing respiratory complications. Which of the following is most important for the nurse to keep at the client's bedside? A. Ambu bag. B. Nasal cannula and oxygen. C. Suction equipment. D. Tongue blade. Correct answer, D. Symptomatic treatment and time. Rationale. MS weakens the respiratory muscles and compromises swallowing, putting the client at a high risk for aspiration. To ensure a patent oral airway in the case of client distress, the nurse should keep suction equipment at the client's bedside. NCLEX-RN Practice Questions. Question 95. Which statement indicates that a client diagnosed with depression and prescribed a tricyclic antidepressant needs additional medication teaching? A. I may experience a dry mouth. B. I can take ibuprofen. C. I can take over-the-counter cold medications. D. I should not experience leg cramps. Correct answer, C. I can take over-the-counter cold medications. Rationale. Clients taking tricyclic antidepressants should check with their healthcare professional before taking over-the-counter medications due to the potential for a drug interaction. NCLEX-RN Practice Questions. Question 96. A nurse must give sensitive health results to a client who does not speak English. Which is the best action by the nurse? A. Provide written information in the client's language. B. Ask the client's spouse to translate. C. Utilize a formal translator in the healthcare facility. D. Refer the client to a social worker for assistance. Correct answer, C. Utilize a formal translator in the healthcare facility. Rationale. It is best to use either a translation service designed for healthcare or another staff member within the facility to translate sensitive health information. NCLEX-RN Practice Questions. Question 97. A child with hemophilia comes to the clinic for cryoprecipitate therapy. The nurse should prepare to administer which of the following? A. Factor VIII. B. Packed red blood cells. C. Platelets. D. Whole blood. Correct answer, D. Symptomatic treatment and time. Rationale. Cryoprecipitate therapy refers to a portion of plasma that is rich with clotting factors. Factor VIII is a clotting factor used to treat type A hemophilia. NCLEX-RN Practice Questions. Question 98. A client with a history of alcoholism is prescribed antabuse. The nurse is teaching the client the signs and symptoms that may occur if the client consumes alcohol while taking antabuse. These include which of the following? 1. Throbbing headache. 2. Nausea and vomiting. 3. Blurred vision. 4. Seeing a halo around lights. A.1, 2, 3. B.2, 3, 4. C.1, 3, 4. D.1, 2, 4. Correct answer, A. 1, 2, 3. Rationale. The client may experience a throbbing headache, nausea and vomiting, blurred vision, thirst, confusion, and diaphoresis if alcohol is consumed while taking antabuse. NCLEX-RN Practice Questions. Question 99. A male client has just received discharge instructions from a nurse following the removal of a uric acid stone from his right ureter. Which of the following statements made by the client indicates that the teaching has been effective? A. I am permitted to have a diet high in protein foods. B. I must avoid milk and milk products such as butter and cheese. C. I will increase my daily fluids and include citrus fruits in my diet. D. I will need to drink plenty of fluids and stop drinking beer. Correct answer, D. I will need to drink plenty of fluids and stop drinking beer. Rationale. Clients with a history of uric acid stones are placed on a low purine diet in an effort to reduce the excretion of uric acid in the urine, which accumulates and contributes to stone formation. Purine breaks down into uric acid. Beer is recognized to have high purine content, and thus should be avoided. Clients are also encouraged to increase their fluid intake. NCLEX-RN Practice Questions. Question 100. A nurse is assessing the apical pulse of a 4-year-old child. Which intercostal space should the nurse expect the apical impulse to be located? A. 3rd. B. 4th. C. 5th. D. 6th. Correct answer, B. 4th. Rationale. The apical impulse is located at the 4th intercostal space until around 7 years of age.